Hi, I'm Dr. Margreet Barnardt, your host of the Birth and Baby Show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. This episode is proudly sponsored by Curaden. Curaden aims to create 1 billion healthy mouths because a healthy mouth equals a healthy body and mind. Curaprox Baby gets your child on the right path by starting healthy oral care habits for life. Our products are designed by specialist dentists. The Curaprox Soother supports the normal development of gums, teeth, palate and jaw, and also ensures optimal nasal breathing. The Curaprox Teething Ring with integrated training toothbrush helps your child prepare for the day they start brushing their teeth. Curaprox Baby Teething Ring also promotes the development of sensory and motor skills. The Curaprox Baby Toothbrush gives the gentlest care to your child's precious teeth. The toothbrush makes cleaning teeth fun and joyful. A quick note to the adults about your oral care. It's crucial to balance your oral microbiome. It prevents oral disease and reduces bacteria from entering the bloodstream, thus may prevent heart attacks and strokes. Join the movement. Let's create 1 billion healthy mouths, which will result in 1 billion healthy bodies and minds, making oral health contagious. Visit www.curaprox.co.za. Hi everyone, welcome back to another episode, and I am super excited about today's episode. It's a little bit of a different topic than we normally cover, but it is so important. We are going to be talking about oral health for moms and babies, and for that I've got two incredible guests. One is Dr. Farah Seedat. She is a dentist specialized in pediatric dentistry, and Naseema Osman, who is an oral hygienist. And they both are very, very passionate about working with little ones. So they're very special people. So welcome on the show, Dr. Seedat and Naseema Osman. So I'm so excited about this episode. I've got two incredible speakers with me. The one is Dr. Farah Seedat and Naseema Osman, and they are here with me. Welcome. How are you?
Thank you. I'm good. Thanks, you.
I'm good.
Awesome.
Thanks. Yourself?
Yeah, I'm very good. Thank you. So I think I'm going to start with Naseema. Naseema, tell us a little bit more about yourself and the work you do specifically with moms and babies.
So I'm Naseema, and I'm a qualified oral hygienist. I have recently found my way into the airway group, and that's just brought like a new passion for me. I am a qualified myofunctional therapist, and that's where I, focus a lot on working with kids. So it's focused more on the little kids and the way that they breathe and how it impacts their dentition and just affects their growth in general. It's amazing. This road has just really been amazing. How I've been helping families and the changes that's brought upon with these little kids has just been amazing.
Wow, that must be rewarding indeed. Thank you so much. Dr. Farah, over to you.
Thank you. I qualified as a dentist in 2015, and I've always particularly had an interest in pediatrics since undergrad. After realizing that treating children is way more complex than I thought, it started my journey of seeking more knowledge. I also have a passion for holistic care because everything is truly connected. And I firmly believe in treating or curing children holistically. At the moment, I focus mainly on infants and toddlers at my practice because that's honestly where it all begins.
That's amazing. Thank you so much for that beautiful introduction and getting to know you more. And I absolutely love what you said, that it is about holistic care, because that's what we all stand for at Sister Lillian Center. It's so, so important. And I think that's also why we really felt that this talk needs to happen and that we took hands with you, because pregnant moms, and they all need to know about their oral health, because it's all interlinked for all over well-being. So let's just first start for our lovely pregnant woman. How does pregnancy affect a woman's oral health, and what can pregnant women do about it?
Okay, let me just say something quickly. So basically, there are two elements to this question. I would say it's oral gum health and then it's tooth health. So with regards to gum health, there are, of course, hormonal changes that occur during pregnancy, and these hormonal changes increase a patient's risk of developing gum disease. So you might find an increased risk of bleeding gums, and gums can be more swollen than normal. And you can also get something called a pregnancy epulis, which is a harmful growth on the gum line, which does go away after giving birth, but it can also be removed if it does interfere with oral hygiene. And I would say tooth health as well, because, for example, frequent vomiting may cause erosion of the teeth, which does weaken them. And if patients are, for example, eating the whole day because of pregnancy cravings, then you're constantly getting possibly sugar exposure and acidic food exposure, which further can increase their risk of developing tooth decay. And I'm sure Naseema has something to add there as well.
And then also with regular dental visits, that seems to be a huge, like an important factor that pregnant women tend to, not see as an important or vital part of their pregnancy. And if they do tend to visit the dentist, these problems can be detected at an early stage and be addressed at an early stage to avoid any pain or these symptoms getting any worse.
I also feel like
wonderful. So, yeah.
Oh, sorry. I also feel like it's very important for moms, I would say, to have a checkup done by about 4 months into their pregnancy, because that's when the time when they're most comfortable to receive care. And also it allows the dentist enough time to treat any potential issues before they give birth. Because one of the most important things with regards to pregnancy and babies and oral health is something called vertical transmission, which is completely proven, whereby mothers can actually pass on the cavity-causing bacteria and organisms from their own untreated decay to their baby, either via sucking their dummy and putting it in their mouth, or by kisses, or even sharing utensils. So if you have untreated decay, you can actually pass on that to your baby before they even get teeth, which will then make their oral health compromised because they have cavity-causing bacteria already colonized in their mouth.
Wow, I didn't know that. That is very interesting and very important information to know. I can imagine, you said like by 4 months in pregnancy, ideally you want women to have a healthy mouth before they fall pregnant. I can see that. Yes.
Yeah.
So let's summarize it. So there's two different kind of issues. You can have the more gum health, and then teeth health, your beautiful and white pearls. And regular checkups will really be important to identify issues on time. And regular, what would that be?
I would say because during pregnancy, you are slightly more high risk of developing problems, I would recommend one checkup early on in the pregnancy, like for example, 3 to 4 months, and possibly one towards the end, but also regular cleanings. And I'm sure Naseema will agree, because of the increased risk of potential gum issues, a cleaning is super important, at least once or twice during your pregnancy. And that's just from the professional side, but there's also a very important component, which is the mom looking after her own gums and teeth at home. And that's where the daily maintenance comes in. So brushing twice a day with a correct technique using the appropriate products. And usually what we do is we get patients in early in the pregnancy and advise them on how to brush, where to focus on, what toothpaste to use, what toothbrush to use, and any other product which may help them. We'll recommend that to them. And something that is so important is flossing, because many a times gum issues arise from not flossing enough, because the plaque that gets stuck in between our teeth both can cause gum inflammation and can also cause tooth decay. So it's super important to floss.
So ultimately, it's important for patients to kind of see the oral hygienist or dentist before they fall pregnant. Okay, if anything serious is detected in that time, it can be treated before they're actually pregnant, and it would be a lot more comfortable for them. Sometimes when the patients are pregnant, we need to take an X-ray, and they're not comfortable with doing that, and that can also limit us with the type of treatment that needs to be done. So that's also important. If they are regularly into the routine every 6 months, it comes naturally. And I've seen a lot of patients like us, like, oh, you know what, we're planning right now, and I want to sort everything out. Double check my teeth, make sure there's no cavities. I really don't want to come to the dentist when I'm pregnant. And I would reassure them and say, it's perfectly fine. During these trimesters, the first trimester, second trimester, it's still fine to come and see me. We really don't want to be treating you in your third trimester unless it's an emergency. But that's why we see you early on, to avoid getting to that emergency point.
And on
I'm
that
glad
note,
you're bringing that up. Yes.
Oh, sorry, on that note, it's actually perfectly safe for pregnant women to receive dental care throughout their pregnancy. X-rays are also safe, of course, if they are indicated and will benefit us in making a diagnosis. All that has to be done is they have to wear a lead apron covering their throat as well as their belly. And if that is the case, then X-rays are absolutely safe. Even receiving treatment throughout pregnancy, the main thing is just that a patient can become, like lightheaded towards the end. And all you have to do is adjust their position to make them more comfortable, and they can easily receive dental care.
Wonderful. Yeah, I'm really glad that you ladies are bringing that up, because that might be a fear in women's minds to not go to a dentist when they're pregnant, because it's a knowledge out there that something might not be safe. So wonderful. That's great. Then I was also wondering anything about a link to nutrition and calcium intake in pregnancy. I've heard that saying that every pregnancy costs a tooth, that you lose your teeth or something. What's up with that?
I think it's because mostly when you're pregnant, the dietary habits tend to change a lot. Okay, there's a lot more frequent snacking or cravings that can change, and that's of course altering the saliva flow and the saliva in the mouth. I always say, if you really need to eat sweets, like eat them all up in one go. No, don't snack 5 minutes and then 10 minutes later you have another sweet, because that would constantly keep the pH of the mouth on a very high pH. And then, like Dr. Farah has mentioned with regards to the vomiting and that causing erosion on the teeth. Some people tend to throw up, and then they would immediately brush their teeth afterwards, and that can cause a lot of damage on the enamel itself. Farah, I'm not sure if you would not like to elaborate a little bit more.
Yeah. On the note of brushing after you vomit, it definitely shouldn't be a case where patients brush after they vomit, because the enamel becomes a bit softer. So if you brush, you can actually damage and remove enamel. So what's recommended is you either rinse with water, but if a patient is frequently vomiting, a better idea is to take 1 cup of water with 1 teaspoon of bicarb and rinse with that if a patient is frequently vomiting and the enamel is getting weaker. And then you can basically brush after about 20 minutes or so. But on that point of the calcium, because I actually had to research this, because I've also heard that multiple times, and it is actually an old wives' tale that you lose a tooth while pregnant. And the truth is that, of course, fetuses need calcium to develop, and it gets drawn out from the mother's body somewhere. And according to research, it does say that bones are the first place that calcium gets withdrawn from. So I'm not sure if that thing about the tooth is true, even though it may seem like that, because so many patients have tooth issues while pregnant. But apparently, scientifically, we actually get it from our bones. So the teeth is just more to local factors like eating, not brushing enough, and possibly frequent vomiting.
I think
that makes sense.
It's a myth, in the sense that people would avoid seeing the dentist while they're pregnant. And then eventually when they do get there, it ends up being a tooth removal or tooth extraction, because decay has gone beyond the nerve. And also, we both know once the baby's there, you just don't have time. So there's a long delay before they actually seek dental treatment. So I just think that could be a reason.
Yeah.
True. That makes sense. Yes, that's very clear. Thank you. So then that's pregnant mummies. How about once the baby's out and oral health for babies? What does that entail?
So it's very important that once the baby's there, that we start at feeding, whether the baby is bottle fed or breastfed, the mouth would need to be cleaned. Okay, there tends to be a delay in actually keeping the mouth clean until the first tooth erupts. Okay, and that's a huge concern. If the baby's used to having the mouth cleaned from newborn stage, it's normal routine for them. So you can use like a soft cotton cloth over your finger and just like swab it into the oral cavity to remove any milk that gets left behind on the tongue or the cheeks. And it's also a massage to the muscles of the mouth. So, babies tend to enjoy that. It can be very soothing. And I'll let Farah elaborate on the breastfeeding.
I actually have 3 pointers with regards to oral health for babies. There are 3 components, I would say. It's the tooth health, it's the gum and the general oral health, and very importantly, the growth and development. So under tooth health, like Naseema said, it would be plaque removal, or anything like milk removal, for example, from the time the first tooth erupts, especially, but also before that as well. Exactly what she said, using a gauze or like a cotton swab, and using a remineralizing fluoride toothpaste twice daily once the teeth are out, and flossing daily as soon as there are no gaps in between teeth. Also, with regards to growth and development, this I feel is such a crucial thing when it comes to babies' oral health. And there are so many factors, or there are several factors that can affect this. Number one, the most common one is a dummy. So we definitely want to rather opt for the most appropriately shaped dummy, which is the flatter one. And the 2 that I know which do have favorable shapes are the Curaprox dummy and the Nook dummy. Those 2 are flatter and a lot more favorable and not as harmful on the developing mouth and jaws and oral area. Also, stopping the dummy at the right time is really important to prevent permanent growth alterations. If you stop the dummy early enough, your body actually adapts itself to how it's meant to be and you grow normally again. But if you have prolonged dummy usage, the changes that occur, like your jaw becomes smaller, your teeth get pushed out. When you bite down, there could be a gap in between the teeth. Those things will persist if the dummy is used for longer than what it should be. So I would say 2 years should be the maximum cutoff if you want those growth effects to actually resolve itself and go back to normal. So yeah, that's what I would say for babies' oral health.
And with
regards quite a mouthful. Yes.
Sorry. With regards to the dummy, it's also a really good thing to implement, that once the baby's fallen asleep, to just remove the dummy. Sometimes if the baby just needs that soothing, sucking action, and once they calm and actually fall asleep, it's very important that the mom just pops it out and they don't continue all night sleeping with the dummy.
Wow. I think you both have brought up so many things that for many, many women, it's really new. They don't think about it. And I'm sure you see the after effects from that, right? Maybe you want to unpack on some of the typical problems that you see when it comes then for oral health for babies and toddlers, because of probably these basics that are not known.
Okay, can I go first with this one? Because I see it so often and it breaks my heart. I feel like there are 2 main issues that we see typically when it comes to babies and toddlers. And number 1, it's tooth decay. And number 2, it's the negative growth alterations from using the wrong dummy or prolonged usage of the dummy. And with regards to tooth decay, this is what I see all the time in very young patients. And it really is heartbreaking because tooth decay is known as a multifactorial disease, meaning that there are many factors involved for it to occur. So due to baby teeth being so small and the enamel is much thinner and not as hard as adult teeth, they are way more prone to decaying easily. And that's the problem. And typically in young babies and toddlers, it arises due to lack of brushing enough, improper technique, lack of use of fluoride, exposure to too much sugar in the diet, no or insufficient flossing, lack of exposure to dental care, and very importantly, parents leaving children to brush on their own at a young age. Those factors contribute heavily towards a young patient's developing tooth decay. And due to children changing so rapidly in those first few years of life, it's very important for parents to bring them in at least every 6 months so we can assess how things are progressing and detect issues early when they've just started, or detect things when before they even happen to actually prevent these things from happening. And unfortunately, tooth decay remains the most chronic childhood disease with nearly 1.8 billion new cases every year.
Oh my word.
Mm.
Wow. I can imagine that this must break your heart.
Mm. And I'm sure Naseema has some input with regards to mouth breathing and what happens with dummy usage. I'm sure you will elaborate on that now.
So even when the baby's sleeping, it's very important from the newborn stage that parents need to watch whether the mouth is open or closed while they're sleeping. If they are sleeping from the first time that they come into this world, if their mouth is open, it's to just gently hold the chin up and allow that lips to seal. And when we do that, the tongue automatically goes up to the palate. And that is the natural resting position of the tongue. Okay, so, that shapes the arch, that shapes the palate, that the facial growth gets affected when the child is a mouth breather. And if it's not corrected, that's the way that they'll continue to grow. Okay, and that's why I mentioned the dummy, sleeping with the dummy. That automatically keeps the lips apart for the entire night that they're sleeping with the dummy holding it apart. So in the day when the dummy's out, they tend to continue having that posture because the dummy, it's like the dummy's still there. And then they end up becoming mouth breathers. So it's very important to watch your child sleep up until they're toddlers. Go into their room, stand there for 5 or 10 minutes. Are they restless? Is their lips apart? Are they breathing through their nose? It's very, very important. The issues and the problems that I've been seeing, like Farah says, it's so heartbreaking. Mouth breathing also has an effect on your teeth, and it's been proven to also cause decay. Mm-hmm. So sometimes parents will tell me, well, they don't eat sweets, they don't drink fizzy drinks. Why do they have so many cavities? It's because they're mouth breathing. So, yeah, that's
sure.
If I may add something, the reason I always like to educate patients as to why things are happening so they can empower themselves. And the reason why mouth breathing can cause cavities is because when you mouth breathe, your mouth becomes drier than normal, and saliva or spit is our natural tooth defense mechanism. So anything which compromises saliva will definitely cause more tooth decay and more tooth issues. And mouth breathing, unfortunately, makes the mouth dry, and that's why children are more prone to getting decay that are mouth breathers.
Another important
makes all sense.
Is the bottle, what they drink in the bottle. Okay, so we have tooth decay in toddlers and babies that affect the full front teeth, and it's known as bottle caries, which is very, very common. And I'm sure Dr. Farah sees this all the time in her practice. And that normally stems from the babies going to sleep with the bottle. And when that happens is the mom would normally take out the bottle, but the milk would still pool. And the tongue covers the lower teeth, but the full front teeth is exposed to that milk that gets left behind. Sometimes bottles are filled with juice, and we all know that that's very acidic. So that breaks down the teeth even faster. And it's very sad when we see these kids and the mom's just like, just fix the teeth because I want my child to have a beautiful smile. They're not worried about what actually caused it and how do they prevent it. It's always a quick fix. But it's very important to understand what's been causing it and how to stop doing these things.
And if I may add something, sorry, on the note of the milk bottle and things, like the last gulp which they take, it doesn't always get swallowed. So you'll have the unswallowed milk that pools there. And just that little bit is actually enough to break down the teeth, because milk has lactose, and lactose essentially breaks down to a sugar. So even patients who breastfeed their children, and I always get the response that patients don't actually know this, but breastfeeding, it's been proven that breastfeeding beyond the age of 1 at night does increase the risk of tooth decay. So all you have to do to counteract that higher risk is simply wipe their mouth once they're done breastfeeding, remove the breast, wipe the mouth with a cotton pad or even like a cotton face cloth. And because you're removing that unswallowed milk, the risk of getting decay drastically reduces. And then, of course, when they wake up in the morning, brush their teeth using a fluoride toothpaste, and that will definitely counteract the high risk and hopefully prevent them developing tooth decay.
Amazing, such empowering information. I was going to ask about the breastfeeding versus a bottle, but it's good to hear that also breastfeeding, we also need to be aware, especially when it comes to babies sleeping on the breast, I can imagine. So those are really, really great things to know. I was also wondering, when I was listening now on when we talk about bottles and formula, does it also matter the shape of the teeth of the bottle, where they suck on, just as with the soothers?
I think the size of the actual opening is more important than the actual shape of the teeth, because it controls the flow of the milk. And when the hole's too big, the milk comes out a lot faster, and that will affect their swallowing. Okay, when they swallow too fast, of course, they'll be gulping a lot more air and can make the baby a lot more gassy. But I know there are many bottles on the market now with the teeth that's got the shape almost identical to the actual nipple of the breast, which makes it a lot more comfortable for the babies to suck on. Farah, would you add anything?
Yeah, I would say the shape of the bottle when feeding isn't as impactful as the shape of a dummy. So you rather, so it isn't that big of a deal, I would say, but the dummy definitely, that shape will absolutely impact the growth.
Okay, that's good to know. So we've been talking quite a lot on already on how we can prevent problems from happening, but I want us to come and land this thought that we just haven't overlooked anything that you want every parent to know. Prevention is definitely better than cure. What is it that you would like them to know in a summary?
I go first. Improving oral health care knowledge during pregnancy is crucial. It's been proven that moms who receive oral health care advice while pregnant, their children have a lower incidence of tooth decay. So that's absolutely important. Another factor I would say is parents should get advice from a dental professional, a hygienist, or pediatric focused dentist regarding their child's oral health, and not from friends and family, because every single child is different and has unique circumstances. And what might work for patient 1 will not work for patient 2, for example. And I swear the easiest thing to prevent tooth decay, all you have to do is brush twice a day with the correct amount of an age-appropriate fluoride toothpaste, and floss when there are no gaps. And of course, limit sugars with regards to diet. But that's really all you have to do to prevent tooth decay.
Yeah, doesn't sound too complicated.
I was given a really good summary. But I'll just add to that a few points, is that parents really need to brush for their kids. a lot of parents would, boast like, oh, my kid can brush their own teeth and they're 1 year old. And I'm like, no, you kind of need to do it for them. It's perfectly fine. Let them do it. But you need to just go around again and make sure that you reach all the teeth. Kids tend to only brush the teeth that they can see, and that tends to be the front teeth. Okay. The teeth, the primary teeth or the milk teeth, as we commonly know it as, it's just as important as the permanent teeth. And that's an important factor to remember. It needs to naturally fall out, and hopefully it doesn't get extracted before the time, because that would also shape the face and change the face. Another important thing to remember for parents is that they need to always just lift the upper lip. Okay, sometimes they brush, but they don't brush high enough. And I find that that's where the decay tends to start first. It's on that upper teeth, just under the lip. And when they see it, it's already a lot more lower down on the tooth. So once a week, just lift up the lip and brush and make sure that you've got all the plaque away. And I think we've really touched on everything, but
I would say the very
so
last.
Too. Yeah.
Oh, sorry. Just one more thing I want to add. The very last thing that I always see in practice is that patients assume that baby teeth will fall out by the age of 6. That's true for the front teeth, but the back teeth stay in there till 10, 11, even 12 years old. So that's why it's so important for the back teeth to get very, very good care, because they really have a long lifespan. And parents often say, oh, it'll fall out anyway. That is true, but only in 5 or 6 or 7 or even 8 or 10 years time. And that's a long time for that molar to be in the mouth. So the back teeth really need TLC over and above the front teeth.
And if I can just add one,
I can imagine also that you create a habit already. It's so important for lifelong. It's not just because they are the teeth are there till 11, 12 years, but it's setting that habit for lifelong good teeth, I can imagine.
Yeah. The first dental visit for babies should be by the first birthday or by the time they first do their ups. So parents are not very aware of that. And then when they do come to the visit, it's normally an unpleasant visit because there's some pain or, and then the patient, the child is very scared of the dentist. So the baby should be at the dentist by the first visit. And it can be a very pleasant visit. It doesn't need to be. We work in the range of the child. If they're not comfortable opening their mouth, we'd make them comfortable, and we can always, at the next visit, we try again a little bit more. And parents need to prep the child, prepare them, make sure that they know that it's a pleasant visit, a happy visit. Read them a story about going to the dentist or their favorite cartoon going to the dentist. It doesn't need to be fearful, and there's no reason to install fear from the word go. And at that visit, if the parent has any questions with regards to oral health, that's when it can be answered, or we can recommend products or specifically to the child and what the child would need. So that's why this visit is very, very important.
Great. So I think we've covered really so many important topics. Thank you so much. And I'm sure that those kids and parents that come to you ladies, they will absolutely love it. I hope there's many more lovely ladies like you doing this incredible work. And from our side, we will do our best to work on the preventive side by educating the moms and the parents before it's too late. Thank you so much for coming on and for doing this for us, and all the best with your incredible work.
Thank you so much for having us. It was lovely.
Awesome. Yeah. Thank you. All right. That was really great. Thank you so much. Wow. I think we covered so much. That was very, 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 very good and a good flow. So if you can just send me also your recording, just go send it via email or Google Drive if it's too big. So as soon as we finish the Zoom, it will probably convert on your laptop.
Okay.
Yeah. All right. Wonderful. Thank you for your time.
You're welcome.
Thanks so much. You're welcome.
Okay. Okay. Have a good rest of your day.
Thank
Bye,
you.
Claudia.
See you, Naseema.
Bye.
Bye.
Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.